So nā mai haere mai everybody. We'll kick off with the karakia, I think, Jade, given it's 12:05.
Perfect, thank you. Anyone's welcome to join me if you'd like. Whaia, 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 nā wauratanga o te manatū haora, ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokiri ngā tahi, kia tai atu tātou ki pai tata, ki pai tawhiti, ki pai ora, ki tūturu, ki whakamoa, kia tina, homi e, hui e, tā hiki e.
Well, kia ora tātou. My name's Emma Prestige. I'm the Group Manager for Quality Assurance and Safety at the Ministry of Health. It's my pleasure to welcome you all to our introductory session on Ngā Paerewa, the new health and disability, well, the updated health and disability standards service standards for 2021. I'd just like to introduce the members of the team who are going to be taking you through the presentation today before we set the scene. I'll hand over to Jade and Christine.
Kia ora, thank you, Emma. So, ko Jade Takuingwa, I am the Principal Advisor Quality Assurance and Safety, but was fortunate enough to be the project manager overseeing this review over the past 2.5 years, so I have some good historical knowledge of the project.
Christine Masters, Principal Advisor for Health Cert. Thanks.
Kia ora, thanks, guys. So Jade and Christine are going to take through this introductory session today, which I'm sure will be really valuable and lead to a lot of good further discussion and questions. As Jade pointed to, this has been a really comprehensive journey to update the 2021 standards from the 2008 standards. A huge amount of consultation and input, and it's been an absolute pleasure and privilege working with the sector, for the sector and for New Zealanders as we updated this document. This is a document, as you'll be aware and take you through today, has been approved by the Minister of Health, Minister Little, and we're really proud of the work that everybody who's been involved has been able to produce such a great document that'll provide a really good foundation for us moving forward with the way we care for New Zealanders, but also a good foundational document and a good base document as we move forward with the health and disability system reforms in New Zealand. So it's really great to have this discussion with you today, talk about the review and lay out the plans and receive your questions and comments back is really, really valuable to us now as we move forward. So I'm going to leave you in the very capable hands of Jade and Christine, and I look forward to catching up on the feedback once the session's been done. Thanks, Jade. Haere.
Thank you, Emma. Ka kite. Right. And wonderful. So thank you, echoing Emma's sentiments to everybody for attending. So we have today's slides prepared for you. You'll be pleased to know we probably won't take the full hour. We will take questions at the end, and we ask that you submit your questions using the comments. We have Health Cert team in the room with us. You can't see that, but we'll be collating your questions and sort of answering them based on what's the most frequency, those sorts of things, and we'll do that at the very end. So do send them through as they arise, and we'll address them at the end. So let's go ahead and kick off. The first thing I'd like to do is share this video, which, you know, in addition to Emma Prestige's introduction, we were quite pleased that we were able to have Ashley also do an intro video. So the sound should work, but we will see. Wonderful. Okay. Well, and thank you for the confirmation of those that you could hear it. So I do want to also echo, obviously, Ashley's words there. I know many of you online have participated in the review as well, and it's been a big 2.5-year journey, and obviously we thank you for your participation in the review and look forward to continuing to work with you on the implementation. Christine's just reminded me, you should have a little banner at the top. We did let you know on the invite, but just to confirm that we are recording the session, the plan that for those unable to attend, acknowledging it was a little short notice. My apologies for that. But we'll make this available afterwards. It will have subtitles to make it fully accessible as well. For those of you putting through that you couldn't hear the video, it is available on the Ministry of Health website, so you can hear his gratitude from his mouth. So turning to the slides, so as many of you know, we partnered with Standards New Zealand and Te Aparani Māori Partnership Alliance to develop this standard. We have a copy here. Importantly, the Ministry of Health, we've paid for everyone to be able to download and print a copy of the standard. So the printing is a new capability. So the link to the Standards New Zealand document is available on our website and obviously also on Standards New Zealand website. It was developed by the sector. We'll talk about that a little bit in this session. And we involved over 300 people from across the sector, organizations, people who use the services, Māori providers, a range of professionals, obviously. It was the biggest engagement that this standard has had in its history. The standard will come into effect on 28th of February 2022. So we're going to start going into a little bit of detail in this slide about how we're going to help support the sector preparing for that date. So on this slide, standard implementation, we are just finalizing the mapping, a mapping across. As many of you know, the standard review incorporated not just the health and disability services standard, but also the fertility services standard, the home and community support sector standard, and the interim standards for abortion services in New Zealand. We have a complete mapping document that will be published online, and you'll be notified of that if you're signed up to our Health Cert Bulletin. Otherwise, just keep checking. For now, I'm just going to cover the changes from the 2008 Health and Disability Services Standards to the 2021 Ngā Pae Rewa Health and Disability Services Standard. So very high level, the key thing is that it is structured very similarly to the 2008 standard and pretty much the same. We still have different language, of course. It's been a decade, so we've updated the languaging. We still have the first section focused around rights of the people using services, goes into workforce and structure, and carries on as the current standard does. Some languaging has changed, of course. The other one, so what we used to call standards, could you center in the camera? We are only seeing half your face. Oh, sorry. 13 standards. Okay, apologies. Front and center. We'll tap in and out then. May I have that? Yes, we will send the slides afterwards. Apologies, you cannot see them. So 13 standards we currently have, my apologies, in consumer rights. We are now calling standards subsections. So this is a new languaging. This was advocated by Standards New Zealand publications team, so it's a bit perhaps pedantic, but it's correct. The entire document, the document in itself is now one standard, and now we have subsections. So the key thing here is to kind of notice that we did look, as part of the review, one of the key things we wanted to do was reduce duplication within the different sections, which we have done. So there has been an overall reduction there, which is really good. Which is good. We achieved the intention in that respect. The other thing that's changed that's quite significant is the criteria application framework. So many of you who are familiar with the 2008 standard would know that on one side we have, oh, apologies, I'm getting through myself. In the current standard, there are aspects of this already, which outlines that some of the criteria only apply to some services, for example, residential mental health. So that aspect has been expanded, so to increase the flexibility of the standard and who it may apply to. So at the front end of the document, we have this criteria application framework, which is new, and it outlines which criteria are intended to be applied or do apply across the different settings that this standard is used within. This does provide greater flexibility, and it also allows, should other services be included under the Health and Disability Services Safety Act, we can just add a column at the end and then develop guidance which outlines how the standard can be tailored for those sectors. Speaking of guidance, another big change that we have done is we have taken the guidance, which currently is on, if you know the 2008 standard, on one side we have the sector guidance, it's just guidance. We have guidance, it's in gray, and on the other side you have the criteria. And what we've done is we've actually we, being the Ministry of Health, have taken the guidance out of the document, and it's now available on the Ministry of Health website. So this allows for us to update the guidance more frequently to reflect changing models of care, updated strategies such as Ola Manuia Pacific Peoples or Whakamoa, and just make sure that we're staying fresh. This it also is easily printable, so you just need to expand the sectors that you're interested in, Control-Alt-P, press print, and it will automatically format to whatever paper you're printing on. Of course, this is a new way of presenting this information, so there are still kinks that we are working through, so just fire them through, and the idea is to make this more simple, more user-friendly, more flexible, and so that is the sector guidance as well. Let's see. And now, so that's a little bit of an introduction about the standard, the sector guidance, the layout. I'm now going to hand over to Christine, my technical expert, who will go into a bit more about the mapping and gap analysis that we undertook between the current standards and the 2021 standard. Great.
Thanks, Jade. I'm hoping you can all see me now, full face and full picture. So let us know if we need to adjust anything. So this part of the presentation is really around the work that we've done through the gap analysis, or the mapping that we've done between the 2008 version and the 2021 version of the standards. So we not included in these particular stats, fertility, abortion, or home and community sector. So this is purely the stats between 2008 version to 2021, just to be clear about that. So with the gap analysis, what we did was we determined that some criteria mapped across to from the 2008 version to the 2021 version very well. So there are synergies that really mimic or reflect the intent and the purpose of the 2008 version of the standards into the 2021 version. So those might not be worded in the same way, but certainly the intent is the same. We've called them the mapped criteria. The second category is around partially new, or what we've termed partially mapped criteria, where the criteria has some familiarity, has some synergies with the 2008 version into the 2021 version. However, within the criteria, there's a new element or a new component or something that's got a fresh focus, and we've called them partially new or partially mapped. The third criteria is what we're calling the new criteria or unmapped. So what that means is that it's a new requirement, new criteria in which the sector is not familiar with from the 2008 version of the standards to the 2021. So on the left-hand side, there's some stats. So 72% directly map from the previous 2008 version to the 2021 version. So what that means is almost three quarters of the 2008 standard can be found in the 2021 version. 10%, so 20 of 204 criteria, partially map or are partially there's a new element, but not all completely new, that have been able to reflect synergies between the 2008 and the 2021 version. There's 18% where there is what we call completely new, so new criteria within the 2021 version that wasn't reflected in the 2008 version. So I'm going to move on to the next slide. Thanks, Jade. So this slide is really a breakdown of the gap analysis that we completed. So you'll see the far right-hand column in grey is the general mapping, so the overarching mapping for the entire standard, and those stats there just represent the stats on the previous slide. So from there you can see that we've split across the different service types, and I'm just going to hand over to Jade before I carry on with regard to some of the lower stats there. So Jade.
Hello. So one of the benefits of me having worked on this project for the past 2.5 years as the project manager is that I can talk a little bit about how the process went and how and provide some background information and context. And the context I want to provide here is particularly looking at the total new not mapped for abortion and term standards, which is 62%, as well as the other high ones, which are the home and community support services, 40%, and the fertility at 46%. So just wanting to acknowledge that those percentages of new not mapped criteria are high, and to provide the background and rationale for that. So what we did as part of the project is we provided the subsections and the criteria throughout the standard, and we held workshops with the providers, service users, and health professionals, and a couple of researchers as well, to see whether or not they thought that those subsections and criteria were relevant to the service that they provided, or could be, or should be. And the people in the sector made the decisions that they were applicable to their sectors or could apply. And so therefore, they signed up to them, which is good to know. And I think, and the other important thing is that this standard is intentionally designed to be, and it says this right at the front, that it should be audited against in a way that is appropriate to the size of the service and the scope of the services that are being provided. So that's where the flexibility came in, and that's where a lot of some of the smaller home and community support service providers were able to sign up, and why they supported this, because they acknowledged, and we confirmed, we being the ministry, that they would not be held to the same standard as larger providers. So if you're running a very small organization, what your quality and risk framework looks like will be different than if you're running a really large business that has premises throughout New Zealand. And that's where the flexibility comes in. So that's something we definitely want you to promote in discussion, as well as we'll be providing good direction and guidance in the designated auditing agency's handbook. So that's the handbook which guides auditors so that we can support auditing that is appropriate to size and setting. But that is also something that auditors are well familiar with and trained to do as well. So we'll be continuing to focus on that. And I'll hand back to Christine to go through the rest of the workshop.
Thanks for that, Jade. So that just provides some context around why those numbers are lower, because in fact they weren't part of the 2008 HDS standard, and so we would expect that there's a bigger jump, if you like, to come on board to the 2021 version. So I'm just going to run quickly through the different sector service types with regard to what those stats are at this high level. So for the ARC services who were part of the 2008 version, the total criteria that is mapped across is 74%, with residential disability at 73%, and residential disability including psychiatric services and AOD mapping across at 72%, hospitals, which is our DHBs and private hospitals, also mapping across at 72%, and maternity and hospice mapping across at 73%. So it's great news for us in terms of the work needed to be done to implement the new standards. There's a much smaller proportion of standards that might have been anticipated, and that's good to share with anyone in your areas that may be concerned about that. So I'm going to move on to the next slide. What I'm going to do now is just talk through the 6 sections, just at a very high level, just to explain the format, talk through the different language and the way in which it is laid out in the new standard, and then as we move into different hui in the future, we'll be able to talk through how we're going to help the sector to implement and understand how it's to be interpreted. And we have some slides to discuss that a little bit further in the presentation. So section 1 is our rights. So that's really pretty much the same as what was termed part 1 in the 2008 version. So we have a section level number, so this is 1. We have an outcome statement that is at a high level for each section, and then we have subsections. And for section 1, we have 10 subsections. The last 2, 1.9 and 1.10, are just purely for fertility. So I'm just going to talk through just at a high level again. So 1.1 is Paeora Healthy Futures, and there's 5 criteria within that subsection. Subsection 1.2, Ola Manuala of Pacific Peoples in Aotearoa, there's 5 criteria there. 1.3, My Rights During Service Delivery, there's 5 criteria there. Subsection 1.4, I am treated with respect, 6 criteria. 1.5, I'm protected from abuse, 6 criteria. 1.6, effective communication occurs, there's 6 criteria in there. 1.7, I'm informed and able to make choice, 9 criteria. 1.8, I have the right to complain, 5 criteria. So you'll see those subsections are familiar with and have synergies certainly with the 2008 version of part 1. What is different for our 2021 version is within the criteria there's particular emphasis on some of those criteria that are new and strengthened around Te Tiriti, and we'll go into those as we go through the sectors and the future workshops in more detail. So again, at a high level, section 2, workforce and structure. So that really reflects the 2008 version, which was organisational management. We again have a high level outcome statement, and we have 5 subsections with varying numbers of criteria. So you'll see 2.1 is governance, it's got 11 criteria. Quality and risk has 8 criteria. We have 14 criteria and 2.3 service management, and 2.4 healthcare and support workers have 7 criteria with 2.5 information with 3 criteria. So I'm just going to go through each of the sections to just give you a big picture view of what and where it now sits. So section 3 is pathways to wellbeing. So this was our old part 3, which was our service continuum. We have an outcome statement here again at a high level, and we have 8 subsections. And again, you'll see the familiarity in some of the terminology, which is slightly changed, but has the same intent. And again, with some criteria that has different emphasis within it. So 3.1, we have entry and declining entry with 6 criteria. My pathway to wellbeing, 7 criteria. Individualized activities, 4 criteria. My medication, 12 criteria. Nutrition to support well-being, 7 criteria. Transition, transfer and discharge, 5 criteria. Electroconvulsive therapy, 4 criteria, and that really is only relevant to DHBs, public hospitals, mental health units who undertake this. And 3.8, the final subsection in section 3, obtaining and caring for gametes and embryos, 8, which is 8 criteria, and again, that's only relevant to fertility. Bear with me, I'm just going to find the next slide. Thanks, Jade.
That's it, isn't it?
Yes, it is. Thank you. So section 4 is person-centred and safe environment. And this reflects back to the part 4 that was the environment standard, a safe environment. So here again, we've got an outcome statement, and we've got 2 subsections here, the facility with 7 criteria and 4.2 with security of people and workforce with 8 criteria. Lovely. Section 5, we've got infection prevention and antimicrobial stewardship. So you'll recall that section, or part 6, was the last standard in the 2006 version was actually infection prevention and control, and we've just swapped the last 2 sections around, and you'll find that restraint is actually now section 6. So section 5 is infection prevention and antimicrobial stewardship, as I suggested, and again an outcome statement at a high level with 5 subsections, and we've got governance here with 4 criteria, and that is different to the organisational governance. This is governance around infection prevention and antimicrobial stewardship specifically. 5.2 is the infection prevention program and implementation, which has 13 criteria. We have 5.3, this antimicrobial stewardship program and implementation, which has 3 criteria. And the final 2, we have 5.4, surveillance of healthcare associated infections, 5 criteria, and we have the environment again with 5 criteria. So the last section slide is, as I said, restraint and seclusion, and again a high level statement, outcome statement, and here we have 4 subsections. So we have a process for restraint with 6 criteria, safe restraint with 8 criteria, quality review of restraint, 1 criteria, and again we have 6.4 seclusion, 9 criteria, which is actually only relevant for district health boards with mental health services and also some residential disability and intellectual disability services under the Act. I'm just going to hand back to Jade. Thanks.
Kia ora anō. So this slide is different from the one I've been presenting for the past 2.5 years, which is cool. And the key thing is that the standard was made available on the Standards New Zealand website on 30th of June, which was exciting. And that's kicked off our sector engagement. So first, what we're going to be running are online workshops. This is the first of that series, and this is the general overview. Starting next week, we'll be running by each section, so it will be our rights, etc. Those dates are available on our website, and then also on a slide later in this slide deck. They are at lunchtime to try and increase your people's availability, and those will be open to anyone. We are then going to be running a pilot of the 2021 standard. So this was a request by the sector just to see how it was going. And Christine will talk a little bit more about what that will look like in the next slide. Following that, we will then run targeted sessions and are also accepting invitations to any conferences or working groups or similar, which you being the sector, anybody would like us to attend to discuss the updated standard. The targeted sessions will then be focused by service type or audience, so to speak. Of course, they're still open to everyone, but we'll just tailor the content so it's relevant for those services. So we'll run one for our designated auditing agencies, which will be auditor focused, one for people in whānau, so that way, you know, they understand their rights as outlined in the updated standard. Māori health providers, throughout the standard, there's increased support for all providers to meet their Te Tiriti requirements. So what does that mean for a Māori health provider? What does that mean for other health providers? And then, of course, we'll break it down by age residential care, residential disability, etc. And then following that, during this whole time, and I think starting we're just finalizing this survey, but we're going to be running a survey which is checking in with you, the sector, to see what your comfort levels are with the updated standard. We acknowledge there will be a degree of time and transition and needing to become familiar with the updated standard, but we're going to try and get a sense about where your current concerns are, where we should focus some of our workshops, what resources you might find useful if we were to develop them, and that sort of from December onwards will look to be responsive to what you've reported to us and provide workshops based on that feedback. And that will all be in preparation for that 28th February 2022 date for compliance. The other thing which Christine will shortly talk about is that we are going to be providing a period of transition as we acknowledge the time it will take to become familiar with the updated standard. So what that looks like in terms of certification periods, Christine will talk about shortly. I'll hand it back to you, Christine.
Thanks, Jade. So as Jade has suggested, we're going to be running an audit pilot to the 2021 HDSS standard, and really the purpose of this is to test the implementation process for the 2021 version of the standard. We want to have as smooth a transition as possible from the 2008 version to the 2021 version. So in doing so, what we're wanting to do is to work with DAAs and providers who would like to volunteer to take part of this, and we're going to run the pilot between August and November this year, 2021. And what we're wanting to do is for any service providers that have audits due, their usual certification cycle or surveillance audit due in this time frame, that might be from the ARC sector or residential disability, including psychiatric or private hospitals such as hospice, birthing units, and private hospitals. We would like to engage to be able to run the audits alongside those audits. So what that means is the audit will take place as per the 2008 version of the certification framework and schedule as per the provider's schedule as would normally happen. So the audit outcome and the findings will not be impacted in any way. So that process will just run as per usual. And what we're going to do is sit another team alongside that audit at the same time on site, and we're going to run through the HDSS 2021 version of the standards, and we're going to run that through the Ministry Health Cert's internal processes to ensure that we've got the processes tweaked in the way that they need to be to ensure that their transition process from 2008 to 2021 is as it should be. We're going to be running, as I said, a mix of certification and surveillance audits. So if anybody's interested in that, we would really strongly encourage you to get in touch with Health Cert on the Ministry's certification, Health Cert certification info line. And if you don't have that, we can give that to you. So the learnings from the pilot are going to support the transition and the implementation. So I want to talk to you now about the way in which we're going to stage the implementation process. So from the 28th of February 2022, once 2021 version goes live, we're going to provide a staged, transparent and non-punitive approach to implementing the standard. So what that means is where there are any criteria that we've deemed through our gap analysis process to be partially new or partially mapped, so there's a new element to that, we're going to have a grace period of 6 to 12 months where the provider won't receive a finding, a partial attainment, if they're making progress towards that, but it doesn't need to be fully implemented until the end of that grace period. For the new criteria and the unmapped criteria, we're going to apply a similar process as what we did for Interai for the aged care sector, and we're going to have a longer grace period, 12 to 18 months, from the end of February for the sector to be able to have time to fully implement those new criteria. So what we would expect is that of the mapped criteria, which is the majority, that process will continue as it is currently. So therefore, if when the auditors come on site, you provide evidence towards that criteria, then you won't receive a partial attainment. However, if you can't evidence that, it will be as it is currently, and a partial attainment will be given. So for the partially mapped or the partially new criteria and the new criteria, or those that didn't map across to the 2008 version, you won't receive a partial attainment in those grace periods, as long as you are showing some progression or some sort of action plan or planning to implement that. So some progression towards implementation through those grace periods. Also, to support the sector in this, we are also providing some online resources around learning modules, particularly around Te Tiriti content of the standard, and we'll let you know when that's available and up. On the website where the sector guidance is, you'll find a lot of links to relevant reference material that will also help for the sector and for yourselves to understand how we would be wanting to see the new elements implemented. We've also restarted or re-established the Health Cert Bulletin that had a wee holiday during COVID, and we've released that. I think it went to the sector yesterday, and that's going to be coming out quite regularly, approximately every 3 months and over the course of this implementation period, so that we've got a way in which to feed any changes or anything that's happening in the space with you as easily as possible. We're also doing an update of the DAA handbook, which will be aligned with the 2021 version of the HDSS standard, and also the audit implementation and the learnings from that will feed into that as well. We will, as Jade said, be also running some regular stakeholder surveys, because we need to know from your perspective what it is that you need us to think about and consider that we might not have, to add into thought processes and to add into the implementation process for the the workshops and for implementation as we move forward. And we really want to hear that feedback and understand any thoughts or comments you have in that space. And again, just to reiterate, if there's any meetings or forums or events that you're linked into that you think it would be useful for us here at HealthCert to be able to come and present to help share the implementation knowledge of the updated standard, we'd be really, very happy to do that.
All right. I might advise, so it's 12:46. So I think perhaps what we'll do is this information, upcoming lunch sessions is available on our website. So perhaps we can ask Gail to pop that link into, if she hasn't already, into the chat. But for now, we'll use the last 10, 12 minutes to go over some of the questions that you've sent through. I'm going to stop presenting for now. Let's see if I do that. Stop presenting, yes. And hopefully you can just see our faces now. Perfect. So I'm just, give me 2 seconds just to organize these. So these are the questions about the pilot, which I thought perhaps you could answer. And that's a good one. Cool, that's a good one. You hear me judging your questions, apologies. Just trying to pick the ones that will be most relevant to the most of you. And you guys have raised some really good points, which is why questions are so important, because obviously not one person can think of everything. So I've had a couple about sector guidance that I want to answer. So how will we be advised of updates to the guidance documents? So HealthCert is overseeing a stakeholder database, and in that we do have key groups which we know proactively will want to be informed when there are updates to particular service standards, but we also accept emails or people who want to be notified of that. So for example, designated auditing agencies will be notified anytime there's an update, but fertility service providers would only be updated, presumably, when the fertility service sector guidance is updated. So just email certification, our email at health.govt.nz, and we'll add you to that sector guidance. Another question about when we are being audited, will the sector guidance update be frozen at a minimum of 12 weeks prior to the audit? That's a really good question. What we will be doing is we'll have notifications on when those changes has occurred and what's changed. Kind of, if you're familiar with Ministry of Health COVID-19 guidance, they always let you know what has changed and what date. So there will be a similar system in place as well. And so that's something we will also look to address as part of the guidance for auditors as well and providers to make sure that we've covered that. So good questions. A couple about pilot as well.
Thanks for your questions. They're actually, really, really good. So I've got one question here about, will we be including surveillance audits in the audit pilots? So yes, so we would like to, and we need to do both certification and surveillance, because they have different processes within that, and we need to test both. So yes, we do. Will the pilot process also look at timeframes and additional costs that will inevitably occur? So that's a really good question too, because doing the audit pilot alongside the usual process will give us a really good indicator of, is this going to take longer or is this not? Or because we've reduced the duplication and reduced the numbers of standards, if you like, or subsections, etc. Will it actually be a comparable process in terms of time required on site? So can't answer that question right now, but certainly with the pilot audits, that will really help us to understand exactly what this means, and then from there inform further discussions. I have another question about the pilot, and that's, do we ask our client or do we wait for them to volunteer? So what we're going to do is this afternoon we're going to touch base with all our DAAs and also look at the scheduling of what service providers are due for their audits in the next 3 months or so. And then we are going to contact the providers and just see if they're willing to participate. But if you've got clients that you know of that you think want or may wish to be part of this, then don't hesitate to share the word and just let us know as well through the Certification Health Cert email line. So we think it's going to be a really good opportunity to do a robust process in which to test the standards. So that's really good. I have another question here around when will the update be for the DA handbook? When will that be available? So we're expecting that to be available towards the end of the year. And the reason for that is we want to really do the audits, the pilot audits first, because that will also inform some of changes within that process that we might need to think about and include in the DAA handbook. And another question, where are the definitions of service type defined? That's a really good question. Most of them are defined in some way at a high level in the Health and Disability Safety Act. However, we can probably put that up online at some point, or provide that information if you need clarity around the different service types. So to be clear, what are the service types? We're talking about aged residential disability, which is intellectual, physical, sensory disability. We're talking about residential disability, mental health or psychiatric and AOD. We're talking about public hospitals and private hospitals. So we're talking about your private surgical hospitals and your DHBs and that. Hospices are hospice service type. Birthing units are your maternity birthing units. Fertility is those services providing fertility. Abortion are those services providing abortion services. And home and community sector standards services are those that are providing home and community services in the community. So I don't know if that's answered your question, but we can certainly make that clearer for you if you need that. I'll hand over to Jade. She's some more.
Okay, perfect. So I was hopeful for 2 seconds I would get through all of them, but we're not going to. But that's okay. Fire them through, and we'll certainly look to address them, if not in this session, in via email, these sorts of things. Or feel free to give us a ring. So there are a couple questions about the mapping document. And I just wanted to say that this information will be available when we publish it on our website. So hold off on that. Is there consumer, back to the DAA handbook, is there consumer auditor input to the update of the next DAA handbook? I personally hadn't thought of this, yes, but absolutely. For those of you who have been involved in the standards review, consumers were an essential part to that review, and that will continue as we move into implementation. I did want to also say that Te Aparangi Māori Partnership Alliance, who provided direction and guidance on the review of the health and disability standard, we've extended their terms of reference, and they will continue to provide guidance and direction through implementation, and that does include a consumer as well, and we will be working closely with them on the DAA handbook. Not that will be the sole consumer. So I just want to say this is a really good question, and absolutely. Let's see, do we have time for one more? This one, perhaps?
This is a really good question, actually. Are you planning updated patient tracer audit training? Yes, I think we need to do a refresher for that for sure. I'm very happy to do that. Might be a little bit further down the track. We're not intending on changing any of the tracer methodology that's in place currently, although we may in the future do that to support the implementation, but that's a conversation to be had still. So no changes to the current tracer methodology processes, that will remain, and we can certainly do some training around tracer methodology. I'm very happy to.
Perfect. And in the last 5 minutes, I just want to Thank you all for coming. We do still have a few questions, so feel free to email us through if we didn't answer yours. I do want to end on time, of course. So I just want to thank all of you for making the time to attend this session. I hope to see your initials at our upcoming sessions. And as you know, it's going to take a whole heap of the sector in order to implement this updated standard. And I'm really excited about it, as is HealthCert. So I'll just close this off again with Manatū Hauora's karakia. Thank you for coming. Whaia, 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 ngā waratanga o te Manatū Hauora, ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokari ngā tahi, kia tai atu tātou ki pai tata, ki pai tawhiti, ki pai ora, kia tuturu, kia whakamoa, kia tina, homie huie, tāhiki e. Kia ora tātou, thank you for coming and have a wonderful rest of your day. Bye.